in your workplace? How did you handle it?
Actually, yeah, there are a number of difficult situations when we are working in an hospital premises, especially when there is an accident situation or any emergency situation arises, or if there is a lack of staff, in case all of a sudden there is a lack of staff and some number of patients are more. We try to arrange with the help of HR management. They are always there for 24 hours with us to help us out. Our resident doctors are there, and a good team of people are there with us who is working with us in a hospital premises, which help us to manage it.
Well, so why do you prefer to move abroad? In what way it is better than your country? Why don't you serve to your nation?
Okay, actually, there is a two perspective. First is for my higher education, I would like to go for the abroad, as well as I would like to learn their protocols, what our protocols is being followed. Like always, there is a comparison between our therapeutic regimen along with their therapeutic regimen. So I would like to know what is the difference between that. If I come to know, then again I will be resume back into my country to serve my people in a better way.
All right. Well, Vinci, shall we move on to the speaking card?
Yeah, sure.
Yeah, I sent you the card. I think you have prepared it for 3 minutes. If you're ready for the card, you could start your speech.
Yes, we can. Shall I start?
Yes.
Am I audible? Good morning.
Good morning.
Please have a seat. I'm Vinci Vincent, working as a registered nurse in this gastroenterology clinic. So, Julie, am I right?
Yes, my name is Julie.
Yes, Julie. So, Julie, you had undergone some tests, right?
Yes. See, actually, I suffer from this, irritable bowel syndrome, and
Yes.
so that's the reason certain tests have been taken to me. I just want to know that how to handle the situation because, honestly speaking, I'm 25 years old, and last year I got married. Hardly 6 months, my marriage license. So I'm really quite embarrassed to speak about my situation because of this irritable bowel syndrome. I live in a joint family. Hope you could understand what kind of problems I might face and how disgusting it would be. So I need a proper and permanent solution to this nurse. That's the reason I visited over here.
Okay, Julie, I can understand your concern. From your perspective, it is correct. You are a little bit stressed related to irritable bowel syndrome. Am I right? So, Julie, irritable bowel syndrome is nothing but your intestine is little bit sensitive now. Okay? So, before I go into detail, can I know what are the disturbance or what are the symptoms are you facing with IBS, that is irritable bowel syndrome?
Yes, see, that's what I told that. This is a problem which started to arise after my marriage, after the first month of my marriage. Earlier, I didn't have this problem. Initially, it started with, gas and bloating and some kind of a cramps. At times, I had diarrhea as well as constipation and
Okay.
severe abdominal pain. So the gas is something quite intolerable because whenever I sit and bend, it is quite uncontrollable. So many disgusting episodes I had in my family. Really, it's quite embarrassing to speak on it.
Okay, I can understand. So you're having a severe cramp-like pain, okay? So if I want to assess the pain, level of pain or intensity of pain, if I'm telling you to give a score from 0 to 10,
Right, you're good.
pardon? Sorry, I didn't get you.
Sorry, I didn't get you. What did you speak?
I wanted to know about the intensity of pain. You said, no, you're having a crampy pain. So if I'm asking you to score, I will be giving you a pain score, okay? To give a score from 0 to 10. 0 is so
Yeah,
mild.
that's what. Initially, I could say that it started with a mild to moderate. Now it is severe. So I could say 10 on 10.
Okay, that's severe. And have you noticed any triggering factor? What is positive behind it? It's like because of stress or change in your food or change in your lifestyle. As you have recently married and moved to a new family, as you said. It's because of that?
Maybe that's the thing I already told, right? After marriage, only I started to experience this irritable bowel syndrome.
Okay, so do you have any stress in your life? like how to
No, I
cope with
don't
the new
face any
family or
stressful
something
life,
sort of
but
like that? Just
no.
earlier, before marriage, you were not having it, or because of change in your dietary pattern, you feel like what would be the triggering factor, do you think?
Yes, maybe change in the food, because the way I was eating food earlier, a little change in the food habit has occurred. But it's not a stressful life, and I'm a working person, so I just balance my stress. I could not say any stress over here now.
Okay, okay, no issues. So Julie, as I said, it's because of the your intestine or your bowel is been sensitive now. Okay, so when something is sensitive now, we have to make the intestine to a normal level. Unless and until it is not normal, we are not able to cope up with the silent symptoms which has been uh, seen now. Okay, so I know it's a little bit embarrassing, but there are a number of treatment options which are available. The causative factor why your bowel is sensitive, we have no idea. Might be because of some sort of mild infection or something you had in your diet which has caused some reaction inside your intestine. Can be a causative factor which can trigger, there are disturbance because of the stress which is happening in our body, the emotional or any other sort of disturbance. So what would be the treatment which I suggest you is like, as you have severe sort of pain, like 10 on 10 you said, your pain medication. Doctor will be giving you an pain medication, that is NSAIDs. Okay. Along with that, as you said, diarrhea or constipation, depending on the nature of stool, the doctor would be deciding what would be better for you. What I feel like you have to make a change in your dietary pattern. Are you getting me, Julie?
Yes, I could understand what you say. So, what is the diet change is required?
Right. Main issue is your diet. Whenever we have something which goes inside is making a trouble over there. So it's better to go for a bland diet for few months. Okay, less spice diet. Which sort of diet you prefer, Miss Wesley?
Yeah, it's a combined food, vegetarian as well as non-vegetarian. Weekly twice non-vegetarian.
Okay, good. And what about the spice level? Do you prefer more spicy like
Yes,
others?
yes, there is some kind of change in the spice level. Earlier, I know at my home, we won't, go for the very high spices, very moderate, mild food it is. Whereas in my in-laws' house, they just use a lot of spices and they eat more non-vegetarian. So that is what I told right in the beginning. A change in the diet is, there's
Also
something.
change in your diet, yeah. So what now you have to do? We have to normalize your intestine as it is sensitive. So now you
Well,
can go.
Wednesday, actually, the time is up. Thank you for your participation. We have crossed almost 6 minutes.
Oh, six, yeah.
Right. See, that's what. See, what I realized in this is, no, you were continuously only asking me questions. So I'm just getting more brownie points, I realized, because I was only speaking. So you were only asking question. You didn't clarify this, because first of all, what is this irritable bowel syndrome? That, it is a kind of disorder that is affecting the large intestine. Little more in detail, what could be, because I told very clearly that I'm a newly married person, 25 years old, and I got affected by it after the marriage. And you asked what all the signs and symptoms. I told bloating, gas, and abdominal pain, constipation, sometimes diarrhea too. So for that, you should have told that. But thank you for sharing the information. And after the marriage, as you experienced, maybe any kind of diet changes there. So once it has been told directly, after that you should have stopped asking questions, I believe. So you could have started to speak about what food to be eaten, what not to be eaten. So you could say that, stop anything that is gluten-free food you have to eat, refined bakery products, or, the processed food, and sometimes the carbonated drinks and beverages, high protein diet, and even some dairy products. And if you're a non-vegetarian, eating too much of non-veg also could be one of the reasons, as you suffer from this. These are the things which could trigger. So what you could incorporate in order to calm your irritable bowel, you could go for more fiber. Fiber can reduce the constipation, and also it could help to handle the situation of gastric and cramps that you have. And also you have to avoid food whatever it is triggering, and regular food on time. 3 meals a day on correct time. Don't skip your meal and eat it on time. And in case if you are not hungry, eat in less small portions. So that these all the ways that could really help you to regulate your bowel function. And regular exercise also, it is mandatory. Try to do some kind of exercise, brisk exercise in the morning. That could help to cope up with the situation. But I believe that dietitian could plan a proper schedule, and you can stick on to the nutritious balanced diet. And as I told, there is a change in your diet. So is it more spicy compared to what you were eating earlier? At last, after giving all these things, you could have told. Then I might say that yes, compared to my house here, it is good, quite spicy, more non-vegetarian. Then you could say, so I guess it is mainly because of the irritable bowel that you experience this problem. We do certain more tests, and once we confirm what is what, definitely proper treatment could have been assigned to you. And thank you for sharing all the information. And the doctor, the gastroenterologist is the right person to check with you. The doctor is available. You can have a consultation and get back to me, and further I could guide you according to the doctor's suggestion. So this is how you have to say, and you could start your speech.
Good morning.
Good morning.
I'm Insurance working as a registered nurse at this community health center. Please have a seat. And how can I help you today?
Yeah, good to know that you are working in this community health center. My name is Sarah, and I have brought my child. He is 1.5 months old. His name is Vicky, and I just visited the hospital in order to inquire about the vaccination for the chicken pox. As it has to be the first dosage should be given, in this age group, like 12 to 15 months, I believe. So that's the reason I brought him here.
Okay, Sarah. It's good to know that you came to inquire regarding about the vaccination. I just want to know further about Vicky's vaccination. Is the previous vaccination given to him on time?
Yeah, other vaccinations have been given, but chickenpox is yet to be given.
Okay, it's good. You know, the chickenpox is one of the contagious disease. If anyone is having at home, baby is more prone to get it. So it's better to prevent. Precaution is better than cure. So, do you, as you said, he is already scheduled for vaccination. Am I right?
Yes, yes.
Okay. The first dose of vaccination has to be given in the month of 12 to 15. Now he is already 1.5 years. The second dose has to be given when he is 12 to 16 years old.
All right.
Okay. So when you give the vaccination, it protects the baby from getting the infection. That is your chickenpox virus vaccine. Okay. That is a varicella zoster, what we say, the name of the virus. So what is that? When you give vaccination, it doesn't say that 100% of protection will be given to the baby. It gives the protection that is around 90%. Okay, and there is a chance of getting infection, but the complication or the symptoms which is seen on vaccinated baby is less than a non-vaccinated baby.
Well, that is my concern, nurse, because I know one of my nephews, he has got vaccinated, but even then, after vaccination, the child has got chickenpox when he was 2 years old. So that's my concern. In what way it is going to protect? Why after vaccination some children are getting it?
Yes, that is about the immunity of our system. So we never say that vaccination give you 100% security that you are not going to get infection and all. They may be getting infected, but the severity of infection may be very less compared to the children or an adult who is getting chickenpox virus, who is not vaccinated. Depending on the severity. So the one who is vaccinated, the severity, the silent symptoms, the problem the child is facing is very, very less. And what is the another benefit is like the same way there is one more virus known as shingles. So if the babies are not vaccinated with the chickenpox, the baby is getting is prone to have this shingle infection on the baby.
Nurse, I have a doubt. Is this shingles and chickenpox both are caused by the same virus? Are they both same or different?
It belongs to the same family member, but it's the same family member virus. Okay.
All right. Fine. That's the reason I brought my child to get vaccinated for the first time. And but I'm afraid, as I told, that my nephew has got a, after vaccination of, he too got vaccinated in the month of 14 months, and within 2 years he got the chicken pox, and it was a terrific experience. We could not tolerate the child suffering like that. So what is the seriousness of this chicken pox? What are the signs and symptoms? How could I protect my child?
Okay, the signs and symptoms are like fever might be there, like a high-grade fever. Baby won't feel to eat anything. He would be very cranky. He would be tired, okay, because of the changes which he is saying, because of the infection which he is going through it, okay. And they don't need to be given any other medication and all. All home remedies have to be applied. Isolation of child has to be done. Having a personal hygiene has to be maintained. There would be a blister which would be itching, okay. So if you apply lactocalamine lotion to them to just to cool down, so that itchiness would be gone. Okay?
But one
And
thing, nurse, as you told that the home remedies, even my mother said that, we have to go for the home remedies. But why not during the chicken pox, we could take the treatment from the doctor? Why it is not recommended even by the doctor?
okay, because for viral medication we don't prescribe any medication, because if it's a viral, it goes by its own. Like it just takes for 2 to 4 days. That's it. That is the only probation period or incubation period which we say in medical period, and automatically the body fights with it. So we don't feel like to give any other medication. But if we see any complication, then only we prescribe for the medication.
All right.
Okay, so
Is this the chicken pox as well as the shingles? Is it a painful experience because the child, right? He's hardly 1.5 years old. In case if he develops, I'm really afraid. How much it would affect the child, and
we
moreover,
don't.
does it lead to? Moreover, does it lead to any scar or a poke mark on the face?
No, you don't have to worry about the scar. If it is enough, so if it is comes up, or if your baby's tendency to have the chicken pox, as baby grows, the scar will diminish. You don't have to worry about it. Okay, so shall I schedule a vaccination appointment for you?
Sure, that's the reason I brought my child. Yes, you could. If the
Okay, and I
doctor
will.
is available, I could finish it off today itself.
Okay, sure, no issues. As our doctors are available, we will be giving you an appointment of today itself, and I will be sharing a leaflet with you along with this varicella vaccine or a chickenpox vaccine. Other vaccinations are also added to prevent the babies from further infections. Like new viruses are being invented nowadays. So, n number of there is an upgradation in the vaccination schedule also. Everything is given in detail with the leaflet which is I'm providing you. Okay, Sarah? Any other?
I could go through the leaflet and yes, you could arrange for the vaccination now. I could wait and complete the process. And I just want to know any further, side effects of this will be there after vaccination. Any kind of signs and symptoms the child might develop, how to handle the situation.
Okay, once the baby is vaccinated, baby might have fever because it's an antibodies which has been injected into the body. So body might react to it. In case the baby is having fever, then you have to administer paracetamol syrup. Okay, about the dose and everything, doctor would be guiding you. And once you are vaccinated with the baby, please bring the baby. I will be observing it for his vital parameters, and I will be giving him paracetamol syrup. And I will be guiding you if fever arises, then every 6 hours the paracetamol has to be given for 2 days. In case if fever comes, mostly the fever doesn't arises, but there are rare cases like few babies can get the fever. No other disturbance or no other complications we have seen till now with the chickenpox vaccination.
Well, nurse, thank you for your information sharing. Yes, you could arrange for the vaccination.
Thank you, Sarah, for coming and visiting with us. Please wait outside. I will be arranging another nurse. She will call you soon for the vaccination.
Sure, thank you. The speech is 6 minutes. Okay, and moreover, little more clarity I feel it is required, Vinci. See, when you speak about the virus, then when the question is asked, and when you told that about the shingles, what is the difference between, you told that, both are by the common virus. So you are supposed to speak about it, is your medical knowledge has been tested. Okay, so you, as it is given in the card.
Whatever the speaking is that they say, we are not testing your medical language.
No. Actually, if it is given in the card, any virus name or something, you can use it. It is given, right? Actually, it is caused by the varicella zoster virus, right? It is given in the card. Is it available or not?
No.
Okay, it is not available in your
But
card.
I had to varicella zoster, but usually they say you are not supposed to use medical terms or terminologies.
No,
And it's not.
it is given. It is given in the card. You didn't notice it. It is in the second task. It's very clearly given. When they give something in particular, you have to speak on it. What is available in the card, you have to speak. It is given there in the second chance. Is explain about the chickenpox, how contagious it is, and the varicella vaccination. It is called varicella zoster. The full form of it, right?
Yeah, it's a varicella zoster we say for
Yeah,
chickenpox.
that's the zoster, varicella zoster, VZV, okay, varicella zoster virus. Okay, that vaccination, what is it that you have to say, that will be administered to the child to protect the child. And moreover, I asked you, shingles and chickenpox, is it same? Here you are supposed to give a clear information that it is not same, but it is by the same virus. So that virus name, you have to say that it is caused by the virus called varicella zoster virus, and the same virus that is causing chickenpox as well as shingles. But the shingles, it is, if it triggers, it is the advanced stage of that, chickenpox. Due to the weakened immune system, it develops. So when the chickenpox come, if you take the treatment, home remedies properly, you could avoid that you could say. Okay. And also, if it is, so maximum 2 to 3 days, maximum 4 or 5 days, and about the scar and mark on the face and body, it depends on the severity once again. Somebody who has got affected more, for children, yes, even for children also, that mark, 1 or 2 marks could be there, depends on the severity of it. Okay, we could not rule it out. No, blemishless skin will be there, flawless skin will be there. No, definitely there could be some chances for it. Some kind of scar and the mark, deep impression will be there.
Okay.
Okay, and yeah, these points and about the blisters. See, when you say about the chicken pox, how it start to develop, as little clarity about it is required. Like it start like first of all, it starts in the chest. Okay, chicken pox means first of all it starts in the chest region, and with a small blisters or boils. We should not pop it out or touch it. If we do some damage, that could spread. So you have to be very careful. The child might experience a lot of itchiness, so try to scratch, but you have to protect the child. You have to see to that more cold items like a tender coconut and buttermilk, and home remedies that could be more helpful to some neem leaf that you could, when you say home remedies, turmeric and neem leaf that you could grind and apply it on the places, rather going for any medicine or ointment that is not advisable, because there is no medicine for this. Home remedies, within the home remedies, cleanliness within 3-4 days, anybody can be all right, even for adults. For children, hardly 3-4 days, and it could be all right. Okay, so that point you have missed, I believe. And you were in a hurry to complete it. So when I was asking, okay, shall I arrange for a vaccination, like that you said. When I was asking some question that is mainly about, the how painful it could be for the child, because he's hardly 1.5. So for that you told that it is not, that is something you said, and then okay, shall I arrange for the vaccination? You didn't complete that. What did I ask? The number of days also you didn't say it properly. And cleanliness, you said, home remedy, you said. What is the home remedy that you didn't clearly speak? Okay.
Okay.
Right. I felt like in a hurry you have completed. Maybe the last card I told you stop, right? So that would have struck your mind. I don't know. I felt like clarity weren't there. What is chickenpox? When I asked, no, you told it is contagious, but how it starts for a lay person, the blisters will be there. It is painful and it starts and disappears. But as a child, the children might get the itchiness and they might scratch. You have to avoid. You have to be careful. And if it is possible, just only the inner garment. Make the child free without wearing any dress, because getting exposed to natural air and cool